Hi, this is Jessica DeMassa. I'm here at HIC 2017, and we are in the HISA Studio with Rob. Rob, can you introduce yourself for everybody watching?
Hi, I'm Rob Pearlman. I'm a junior doctor and the CEO and founder of Medapp. Medapp is a company that I started about a year ago to continue the work that I'd been doing on a bunch of apps that I wrote when I was a junior doctor to solve some of the problems that I had that I ran into.
Okay, so tell me a little bit about that story. I want to hear how these apps came about. What do they do? What problems are they solving?
Sure. So the first problem that I encountered when I was an intern was that in the after hours environment, so outside of the normal office hours of the hospital, there was you had to continually round on the hospitals on the various wards in order to get the jobs list. So the nurses are there writing, can you please see this patient to rechart more fluids? Can you please admit this patient? Can you please rewrite the medications? And you'd be looking after 200 patients, and you'd continually be doing laps of the hospital in order to get these job lists. And then when you had to see something and you'd take a blood test or request some imaging, you'd have to try and set a reminder so that you'd go back and actually chase that result. And you're writing all this down on paper, and it very quickly becomes a mess. So After Hours was designed to try and manage all of this information and set reminders so that you're not letting test results and things like that slip through the cracks.
Fascinating.
So I spent 2 years with the support of the senior doctors at the hospital where I trained, trying to run that through the IT department, and found out a lot of interesting things about the complexities of working with public health and how all the pieces interlink. And ultimately, we stopped moving forward with that project. And part of the reason for that was that as a junior doctor who was still working 60 hours a week, trying to support an application that was going to be deployed and actually used in the hospital was going to be very complex.
Sure.
The second application is an app called Rounds, and it essentially replaces the daily rounding that a team. So when you've got a medical team consists of a couple of consultants, a couple of registrars, and a couple of residents and interns. And even in the most digital hospitals, we've still got where everything's typed, you've still got the medical team printing out the rounds list and doing a little to-do list in order to do their job.
Okay.
And this is pretty inefficient because the team splits up and you've got to get back together in order to tick all the boxes. And so we've essentially digitized that, and I used that for the 2 years that I was going through my training.
Uh-huh.
And we're now at a position to be looking for trial partners to see if we can embed this in a team in a public hospital and really start to see what I think are going to be the efficiency benefits of that.
That's fantastic. So I want to ask you a little bit about, so you've got multiple apps, you're running a new
3
company,
apps.
right? So you're a startup, you've got 3 apps, and you're basically running a startup company as a physician innovator. So tell me a little bit about that. What are some of the challenges that you've had as a startup in the healthcare space here in Australia?
Well, I think they're the same difficulties that you find everywhere. You're working in a highly regulated industry, and there are some pretty big incumbents in that space. But where I think we've tried to position, or where I've ended up, is the areas that haven't been digitized. And as we've grown in scale and I've got now a team working with me, it's become a lot easier to start to have the conversations with hospitals to deal with their security requirements and their audit processes. So yeah, I think that's fortunate. I think that there's a lot of goodwill towards clinicians that are coming forward and trying to put the solutions forward, but the lead times are often enormous.
Yeah. So is there anything that some of these larger organizations, either the hospitals or the incumbents that you mentioned, even the government, could do to help make a startup's job a little bit easier in terms of building applications and deploying them for testing or uptake?
So something that a lot of the New South Wales health services are doing at the moment is forming innovation committees or junior doctor quality and safety committees.
Sure.
And these often have senior clinicians that are associated with them, and the whole purpose is to try and find a little bit of best practice that might exist in other centres or to come up with their own ideas about how they can actually make best use of this digital health revolution, which is really, the IT, healthcare must be one of the only spaces in the economy where the introduction of computers has actually led to a decrease in productivity. And I think there's a real pushback, and people are starting to demand that this change. And people are looking for solutions in terms of how do we make clinicians more efficient, and how can we demonstrate that there's a flow-on effect to improve patient care as well.
Fantastic. Well, best of luck to you in launching your apps further into the health ecosystem here. Thank you so much for joining us in the HISA studio. It's been a pleasure having you, Rob. I'm Jessica DeMassa, reporting from HIC 2017. Thank you.